So my name is Jeff Lindor, founder and CEO of the Gentleman's Factory. We're really excited about this conversation today. So, I want to kick it off, and I want to hand this to Juan Perez, right? And Juan Perez is the president of Kappa Beta Sigma Chapter Phi Beta Sigma Fraternity Incorporated. Ron, show is yours, my brother. Welcome, man.
Good evening. Thank you, Jeff. Jeff and I have known each other quite a long time. It's amazing how sometimes us men of color find each other in so many different capacities. As Jeff said, my name is Juan Perez. I'm actually the CEO of Hybrid Media, a minority business enterprise that's based here in Brooklyn. And I'm also the president of the Brooklyn chapter of Phi Beta Sigma Fraternity Incorporated. On behalf of the Brooklyn Sigmas, I would just like to welcome you to this very important discussion. These are, of course, very interesting times and very important times that we're living in over the course of our country's history. COVID-19 is, of course, disproportionately affected our communities and extremely hard, hit us extremely hard, and has even claimed one of our very own chapter brothers, Brother Jared Sockwell, who is a teacher and assistant football coach at Nazareth High School. The events of the past week, post the census murder of George Floyd, have also gripped the nation. This, of course, follows the deaths of so many others, Eric Gardner, Breonna Taylor. I mean, the list goes on. So I just wanted to, before we get started, just take a moment of silence for those that we have lost over the course of the years. All right, thank you. And from east to west, all walks of life, people have now taken to the streets in protest of the mistreatment of the Black man, specifically in this country. What these two colliding events, COVID as well as the protest, have highlighted is racial disparities in this community, and specifically in Brooklyn, and the economic development and social services, there's racial disparities that exist. Our chapter is committed to the motto of Brooklyn First. As such, we have partnered with Jeff and the Gentleman's Factory to bring you this very important discussions to speak about the role of Black men in the US Census, ensuring that we are counted, and how all of this plays an important role in ensuring our communities get access to the resources that we need. So I'm gonna kick it back to Jeff. We're gonna run the fast break down the right side of the court, since that's all the kind of basketball that will be played for some time now. Jeff?
Awesome, man. So, thank you again. So excited to be partnering with such a prestigious organization. So thank you, gentlemen, for the great work that you do. Let's get straight into it. Today is going to be a very powerful conversation about the census, right? So, people hear the census and, and it's like, why is it important? Who cares, right? Some people say, right? Or what is the significance of the census, and what are the ramifications that it has in my life, in my family's life, in my community's life? And, we're here to have a deep dive about the reasoning for the census, how it affects our communities. And, the goal is after this for everyone to fill it out if you haven't done it already. But I know that we have also a lot of, community leaders in here, and, we have lots of fathers and husbands and advocates, etc. So with the information that you receive here today, it's our hope that you disseminate that into communities all around you, and so that we can fill out the census, because the theme or the purpose of today is called Black men, we count too, right? And we have a phenomenal panel with us here today. And just to tell how everyone is going to work, I'll be moderating today, and have a whole set of questions. But as you have questions, please just put it up in the chat box, and towards the latter part of this discussion, I'll pull out some of the questions and they'll get answered. So without further ado, I am not going to be reading bios, but because the reason why I'm not going to read bios is because with the gentleman that we have here, it'll take me until next week to read everything, because we have such a powerful and amazing panel here. But today we have Luc Severe, right? Luc is a member of the National Advisory Committee for the United States Census Bureau, right? So we have someone directly from the census here today. And we also have Christopher Roker, right? And he is the CEO of Christopher Roker. So he's the CEO of the New York City Health and Hospitals Metropolitan Hospital, right? And he's also the Chief Growth Officer of the New York City Hospitals, right? So round of applause, round of applause. Oh man! And then last but not least, we have Keron Alleyne, and he is the Deputy District Manager of Brooklyn Community Board 5, and he's also a candidate for New York State Senate District 19. Oh man, so so we have a community organizer, we have a executive in the healthcare lens, and we also have someone who is directly associated with the Census Bureau. So again, today is a really powerful discussion, and let's get ready to rumble, right? I want to start it off when it comes to healthcare, right? So our community just experienced, something that we haven't experienced perhaps in our lifetime, COVID-19. The world experienced it, but specifically the Black community has experienced it in greater detail. And one may ask, what does the census have to do with healthcare? So, I would love for Mr. Roker to, so my direct question is, how does the census influence healthcare, hospitals, and the delivery of care to our community?
Great question. So first and foremost, thank you for having me. Jeff for putting this on, Luke asking me to do this, Juan for all of your support, and Keron, thanks for joining us as well. So folks, listen, first and foremost, the census is important to fill out no matter what. We need to be counted. And how does it really affect healthcare, a system, a community, healthcare in general, and hospitals? So the census, everything that I'm going to talk about, it uses the census data to drive to either how the hospitals get paid or how the hospitals with their local communities have programs and services for our communities, right? And so what do I mean? So Medicaid uses census data to drive to a formula on how payments are distributed to hospitals. If people know about WIC, Women's, Infants, and Children's programs, it uses census data to formulate how and where those services are needed and the funds that go to those services. If you're talking about CHIP, same thing. It's using data. But for the hospitals themselves, we love the data because it drives to community needs assessments. It drives granularity to what we use and how we go about using the data to provide services and to develop services for those surrounding areas, our catchment areas. So for instance, Metropolitan is primarily 47% of our population is Hispanic. So I would want to know what is the breakdown of my community here in East Harlem in terms of, is it Mexican? Is it Costa Rican? So it gets to the granular level, which we need to know, right? And with that, we can provide different services towards those groups that really need it. In terms of Harlem, where Ebony Carrington is our CEO for Harlem Hospital, she uses that data to drive granularity to her community, her catchment area. So it's very, very important in terms of the data aspect, population, income, where you're from, because we, as the New York City Health and Hospitals, we see a large number of immigrants and the immigrant population. In Queens, where they got hard hit with COVID, it is a huge Caribbean population as well as Brooklyn, right? And so we want to know granularity wise in the whole aspect of where are the folks coming from, and how do we drive the services, and how do we actually talk to our patients, right? If you go to Flushing, which is primarily of Asian descent, but you don't know, is it Korean, is it Chinese, what is it? And so it goes back to data, and data drives everything, all our decisions, and it is so vital that people have to understand we need to be counted. Others will probably talk about roads and monies that go to different things within our community at a local level. And if we're not counted, we don't get that money. And we're talking about billions and billions, hundreds of billions of dollars. It's closer to almost $700 billion that is going towards the census, to those communities, okay?
Got you. Okay, perfect, perfect. So, no, thank you so much for okay, perfect, right? Okay, yeah, so there was just a technical issue. Thank you. Thank you so much for that. And then just to piggyback off what you're saying, and then I'll bring it off to Luke. So now, Luke, you, so with Chris, we were saying that he serves a large Caribbean population, right? And myself, I was born in the beautiful island of Haiti, right? And I came to the States in 1989. But, you know, both of my parents and myself, we, you know, are legal citizens, but, you know, the undocumented community, right? You know, so as I speak with a lot of folks who are from the undocumented community or who may be undocumented themselves, they may not want to fill out the census, right? You know, so what are like, if you can talk to us a little bit about, you know, how census data is recorded, and if I'm undocumented, and if I have some apprehension for filling out the census, you know, please, like, tell us what exactly should we do, and then if I'm undocumented, should I even fill out the census? Yeah.
Sure. Thank you, Jeff, so much for moderating this panel, and a great question. So if you're undocumented, you absolutely need to fill out the census. So a couple of key important points that I wanted to highlight is Title 13 keeps census information strictly confidential, meaning no one, including the President of the United States or the Attorney General of the United States, can receive the information that's collected by the census. And the reason for that is because, just as Chris Roker just said, as far as that information is gathered for very sensitive resource, or to inform very sensitive resources. And so by keeping it confidential, it gives folks more, you know, I guess more reassurance that to take the census and comfort to take the census. It is even more required or important that undocumented persons take the census, is because they are a big number who are undercounted in the nation, as well as they're the ones who need a good amount of resources, such as housing, healthcare, and all those different things that the census data uses to inform. And so, as Chris stated, there are several different uses for the census data, and that being, if you're in a certain area, the districting of your elected officials is determined by the count in that community. It also the count that you make or the census that you take in contributing to the count also determines how much resources are allocated in that community. And so we see that New York City is the largest existence of public housing. We have several undocumented people who are in large family homes or in small family homes who are not counted, and so resources are not equitably allocated to those communities because they're not represented. And so I encourage everyone who is documented and undocumented to please take the census, because it impacts not only the community, but yourself and the resources you have access to.
Oh, wow, man. Thank you so much for that, Luke. So now my question for Keron is, today's topic is Black men count, right? So, like I mentioned, the undocumented community, but if you could talk to us about why is it important for Black men specifically to take the census seriously?
So Jeff, thank you for that question. Luke, I want to thank you for asking me to be a part of this panel. It is an honor to be on a panel with you and Christopher Roker. And I want to thank Brother President for continuing to lead the Brooklyn Sigmas through the highs and lows of everything that's going on right now. Just really appreciate your leadership. Back to Jeff's question. Black men, we count. The whole reason for this panel. I was excited when I first heard about this panel discussion, because I think to Luke's vision, this hasn't been done. This sort of dialogue has not been done for Black men specifically. And if it echoes everything that's happening right now, Black men have been treated as though we are invisible. And the census is a direct representation of that. Black men on the city level, well, not on the city level, in general, are the most undercounted of everyone. I'm talking about from the ages 18 to 50, in every category, we are the most undercounted. So we are deemed invisible by the city, state, and federal government in every respect. So I always like to make it personal, to localize it, to make it make sense to you. And I use myself as an example. For some of you, this is like your third, fourth census that you're doing. For me, this is my first census as an adult. I'm a part of the 19 to 29 age bracket. And in that age bracket, we are the most undercounted out of everyone, out of all of Black men. So when you think about it, my demographic really, really needs to be a part of this, Black men in general, altogether. We're in a time where specific answers are needed. Answers are needed. And when we look at Black men and Black people in general, the first census, which took place in 1790, we were counted as 3/5 or 60% of a person. So if Black men are going to be the leaders, the community leaders, if we're going to be the people's fraternity and make sure that, our communities, our voices are heard, our communities are seen, the census is a no-brainer. We have to do it. We can't shoot ourselves in the foot when we're marching and in the street asking for justice, and then coming off of the heels of COVID-19, Chris could speak to this. When you look at the male to female comparison in terms of who was hit hardest, men were hit the hardest. Black men were hit extremely hard. So all in all, Black men have to do the census because we are the ones being disproportionately impacted across all spectrums, and we can't shoot ourselves in the foot by being invisible. And COVID-19 has also, exacerbated that. When we look at COVID-19, and this is me personalizing again, some of us are fathers on this thread. I have a 3-year-old turning 4. In 10 years, he will be 14. So for the next 10 years, I have to make sure, well, specifically within this census time, I have to make sure that he is seen. I have to make sure that he is counted. Black children within this entire spectrum from 0 to 5 are invisible, the most undercounted. So it's important for Black men, if we're gonna be quote unquote heads of households, if we're gonna be the leaders of our community, if we're gonna be community stakeholders, if we want change, we have to do the census because it is a part of that.
Jeff, you're muted.
No, I can't. Okay, there you go. Great, perfect. Wow, no, thank you. So, Chris, my question going back to healthcare is, how does the census influence healthcare policy, i.e., the Obamacare and ACA Affordable Care Act?
Yeah, so great question. Once again, so how it's affected is because if we lose seats, right? If our policymakers don't agree with what we agree with, but we lose seats, which we have in New York since 1940, we have lost over, I believe it's like 18 seats, 18 seats. And we possibly can lose another 2 seats in the US House of Representatives going forward. And so if we don't have a voice, a voting voice, then policies like Obamacare don't get done or can get overturned, right? And so policies like Obamacare, good, bad, or indifferent, it wasn't perfect, but it did help the majority of folks who needed healthcare or something close to healthcare where it could help them for visits, right? Maybe not major medical, but more of a preventative maintenance, health maintenance side. And so it's so very important that we have a voice, not only in the US House and the Senate, but when you lose those seats, you lose power. And that is crucial. And the census dictates that. And folks need to understand the census is a very powerful tool. It also, the census also creates those redistricting rules and regulations. And then if you talk about bus routes and the monies that you need for road work, I mean, it's hundreds of millions, if not billions of dollars that folks, how does that really affect me? Well, it will affect you if you don't have a bus route by you, right? Or the routes get lessened. And then what happens when you need to get to work, right? And so people are not thinking about those things. How about mass transit? Everyone knows that New York City needs an upgrade, okay? Either through our public bus system or the mass transit system through the subway system needs a massive upgrade. If we don't have a voice, we don't get monies from the federal government, right? There are so many block grants that are through the federal government that affect the hospital, that affect the community that we service, right? And once again, I'll talk about Medicaid, Medicare Part B, WIC, CHIP. Most people don't know what 340B is for pharmacy, but it's all of these programs that the hospital needs to either get paid, right? Or the services and programs that help in providing for our patient population? You're on mute. Yeah, there you go.
So I'm just for clarity, I'm not the one that's muting myself. It's the admin, so blame it on the admin, right? You know? So for those who don't know, so prior to me starting the Gentleman's Factory, I used to serve as one of the policy advisors to the commissioner at the Department of Correction. So, you know, I was doing a lot of policy work on Rikers Island, and I've seen a lot, right? You know, I've seen a lot on that island. And when I was there, which was about 4 years ago, the inmate population was about 10,000, for which then, you know, for those who did not go back to New York City and those who were convicted, then they would go to upstate or to go to other facilities. So as we're talking about the census, you know, from my understanding, and this question is directed to Luke, and please correct me if I'm wrong, from my understanding, but those that live in upstate, and if I now have someone who's incarcerated, his census, he or she would be counted in upstate New York or wherever the county is, right? So is that still the case? Am I right? Am I wrong? So the question, the direct question is, how are incarcerated families counted in the census? And to be even more specific, if I have a relative or someone who's close and who lives in my house, but he's incarcerated or she's incarcerated, are they counted?
So, a good question. When I joined, I was appointed to the census committee about 4 or 5 years ago under President Obama. And during that time, we did a restructuring and retooling of the census because prior to this current census, yes, that's correct, the inmate population was counted in the county that they were incarcerated, which is why you saw in certain communities or cities that had the prisons or the penitentiaries also had more resources and lofty, you know, amenities and things of that nature, because they were counting those inmates as if they were residents of their community. We have changed that, and an account is localized this census. And so if you are incarcerated in upstate, you are counted, your numbers are counted exactly to where you are living, to your home. And that's done through administrative process with the correctional system and rectifying that data and information. But you're absolutely right. that has been a long-standing problem. And that is something that we've rectified that counting measure. And, you know, we do have on the ground enumerators as well as quality assurance personnel who then double checks that information and ensures that it's accurate information. It ensures that people are not counted twice, and ensures that everyone is counted.
You muted again.
Nope, see, again, that wasn't me, man. That wasn't me, right?
Okay, that's why I'm here. I'm helping the moderator.
So, my question for Keron, right? Keron, you know, our communities, you know, COVID-19 disrupted everything, right? And I remember before, you know, 10 years ago, I would see, you know, like one of my close friends, and so many of my friends were hired to be like boots on the ground, census everywhere, fill it out, etc. Now with COVID-19, you know, everyone is home. So how do we fill out the census, right? That's number one. And can we do it online, right? Because I remember 10 years ago, I was still living in my mother's, wait, was I still living in my mother's house? Yeah, matter of fact, I don't even remember my age, to be honest with you, right? But, but 10 years ago, I remember filling out the census via paper, right? So I guess my question to you is, as a result of COVID-19, how am I supposed to fill out the census, and how is this how is this being disseminated out into the community so that folks know if we can fill it out online, then shouldn't there be a spike because everyone is home, right? So I guess walk us through that rationale. So the first question is, how do we fill out the census? And then number two, if it could be done online, shouldn't that be trending on Twitter right now, like in our communities?
That's a real utopia kind of premise that you get. It does make sense that, so to answer you can fill out the census by mail, you can call and fill in the census, and you can do it online. So it's so much more accessible. And with COVID-19, yes, everybody's at home, but everybody's circumstance is different. So when you think about all of the competing interests, we have over 40 million people in the country that are laid off. So their attention might be towards getting employment. So it's possible that the census is pretty low on their priority list. And then when you think about our communities to begin with, the understanding of the census, and just to be frank, I like to make it real simple and localized for people. A lot of people, our people, don't want people in our business, right? So when we look at traditionally, when we've looked at the census, I don't want them knowing my information. They don't need to know your uncle live here. They don't need to know grandma's up here from Trinidad. They don't need to know none of that.
So wait. So now, just to interject, so now you're saying that if someone is like on my couch, that I should also fill them out and say, hey, you know what, Tay is on my couch and he should be filled out as well?
Luke, I see you want to answer. Go ahead.
Yeah. I was going to say, because that is actually a frequently asked question. If the person, it doesn't matter where they're sleeping, if the person spends a substantial amount of time in that place, they are counted as being at home. Everybody's getting that citywide message. Curfew. They are to be counted as members of that household, and it's one census per household. So if you have a 2-family house, you fill out 2, but it's one census per household.
Correct. Also, if your wife is pregnant, if anybody is pregnant in your household, but they will deliver before the census ends, you count that baby.
Right.
Got it? You count that baby, and that is legal.
Wow. Okay. Back to you, Chris. So what are some of the programs for the city, state, and federal government that utilizes the census data, and why? And how does that affect our community and the healthcare system?
Yeah. So I talked about it mostly in the last couple of questions. So Medicaid, right? They use census data to drive the formula for how hospitals will get paid for each one of the patients who use Medicaid, right? WIC, which is Women's, Infants, and Children, calculates through census data how much through income verification, poverty level, of how much food stamps they get, right? EBT cards, and the amount that's on the EBT cards. There's SNF, and then there's this thing called 340B pricing, and this is only one of many programs, but 340B is really for retail pricing, a wholesale pricing for the hospitals, which can make a profit from it for those patients who actually have commercial insurance, and or for patients who don't have insurance, and so we're paying less or at equal to how much it costs to actually manufacture the product, where we fee scale our patient population or self-pay where they can't afford to pay and they don't qualify for Medicaid, right? And so it helps us help our community, but it's not such an expensive burden on the pharmaceutical side, which would be, Part D of Medicare for our patient population. So that's only 3 of multi programs that the federal government funds. But the federal government also funds a tremendous amount of monies to the city for different things like food services, school programs, Head Start. We're talking about hundreds of millions of dollars. And so if you don't fill out your census, right, and you have children and you need Head Start, but we only have a certain amount of money for Head Start and it starts to shrink, then what happens? It's not enough programs. It's not enough seats. It's not enough to pay for expansions, right? And so people do have to understand it does affect you. And it may not affect you right now, 1 year, but what if you have a child in 2 years? Right? And so people have to really start thinking about this is for a 10-year period. And so if we don't do it now, it affects us in 9 years. Right? And so it's very hard to gain seats. It's very hard to gain back that money.
Wow. Thank you for that. So, Luke, I want to do a deeper dive when it comes to data, right? I was listening to President Obama earlier, and he was saying, hey, and he probably mentioned data like 15 times. You know what I mean? And then he was only speaking for like 5 minutes, right? So everything is data centric, data. Some say data, some say data. I say both, right? Depending on who I'm talking to, right? So I'll use it interchangeably in this conversation. So I guess one question that I have for you is, how private is my information when it comes to the census? And, I know that we all touched upon that a little bit, but if you could just do a deeper dive in that. And then also when it comes to data, right? So when it comes to information, I was reading a lot on, Black men. There aren't enough data sets, and when it comes to AI, artificial intelligence, we're not even being recognized, etc. We're undercounted. It's like we're a endangered species. We don't even exist, etc. So I guess what role does the census have in that, right? In really, affecting the lives of Black men specifically, and also how private is my information?
Sure. So I'll answer the privacy question first. Again, Title 13 of the U.S. Code strictly makes the data that you complete on the U.S. Census as confidential, as well as other census. So one thing to clarify, the Census Bureau periodically does surveys, even in between the U.S. Census period. And so that data that they collect also is confidential by pursuant to Title 13. And so when you complete the census, all of that is taken in confidentially and it's aggregated. And then that's where it is then, and you could go on census.org to actually review, or census.gov, excuse me, to actually review the findings of that data and to see how many jurisdictions use that information to kind of do city planning, like Chris just mentioned, all of the different aspects of city planning, from healthcare to infrastructure to schools to social services, et cetera. They give that information, they use that information that's collected. And actually, one of the attendees of this webinar of the Zoom just reminded me that census employees are sworn for life for 72 years to keep the data confidential. And so there are penalties of, great number, 6 figures fine, as well as imprisonment that's very substantial for those who try and leak that information try and sell that information, whatever the case is. But it's used, it's confidential, it's safeguarded. Again, the president himself or herself, the attorney general, him or herself cannot be provided that information. And so as you're talking about, the data set and how Black men are shown in the data set, one of the things I think what's happening right now is a clear indication or very vivid image of what we continuously compete against. And so when there are opportunities for us to fill out information, and Keron mentioned this before, we're very reluctant in doing that. One, because of privacy, we don't want our business out there. But then also, we have other things that we're competing against. Right now, this day, many of us are competing or just trying to stay alive.
Yeah.
We're fighting a pandemic. We're fighting two pandemics. The racism that's happening throughout the nation, as well as COVID-19 that has not yet, passed. And we're still trying to foresee if it will come back with a vengeance. And so as we talk about data and the collection of that, it's done through the engagement of government or these organizations that survey, these survey organizations. It really takes a strategic engagement with Black men, with the Black community. For one, for confidence that the information is confidential, and that secondly, the importance of the information that they're giving is actually going to be used to impact them and better their community, better themselves. So I think that's one of the big challenges right now. And what that does and why that's important is because that then informs the resources that's available for Black men. And not just only from a family perspective, but even from just themselves of, certain healthcare treatment and things that we're more susceptible of, and all of those different aspects. And one last point that Chris mentioned, it also informs who we get to elect in our districts, who then make those policies and procedures, like the stop and frisk, or like the glass window or shattered windows policy and things of those nature. That's where it's really important for us to reinforce to our Black male community that taking the census, completing some of these surveys are really important, so that we have a voice in the needs that we have.
So can I just jump in? So reading the old census data, 2010, here in New York City, it was only 62% of the population actually filled out the census, as opposed to nationwide, it was 76%. So now you understand why New York City has been losing seats, has been losing money, because the census only at 62% is being filled out. And I could only imagine, because they didn't break it down, I could only imagine in our communities, we are probably in the low 50s.
Yeah.
Right?
Yeah.
So first of all, New York City is not being represented right. Number two, we're not being representative right on top of that. So it's really important to get out there.
Right. Well, so now, and I have one more question, and then I'll definitely encourage the audience to put in the questions on the chat as we open up to Q&A after my last question. So Keron is going to take us home. And you as a community organizer, boots on the ground, you heard everything when it comes to the need, how it affects our healthcare, how it affects our future, the importance of it. What could you tell us and put the batteries on our backs as to filling out the census? What can we do as a community? How do we get the message out there? And also, how do we even fill it out?
Right. So Thank you for that. And I was trying to jump in a couple times, but just like Jeff, I can't unmute myself. So I'm sitting there. I'm like, I gotta get in here. But I appreciate that question, Jeff. I want to jump back just a little bit and it goes exactly to your question right now about, COVID-19 has affected us in this way. We're in our homes. How do we get out the word about the census, right? So this is where, as leaders within our own homes and within our communities, we have a responsibility to make sure that we not only speak to family members, but you speak to people in your building.
Right.
You speak to people on your block. Panels like this, the vision is so on point because you target a specific demographic and a demographic that's already impacted to make sure that it happens. More events like this would definitely help with getting the word out. So in the introduction, I was introduced as the Deputy District Manager for Community Board 5. Community boards are your most local level of government. We are municipal bodies that are responsible for the enhancement of service delivery. I think Chris and Luke touched on it with all of the data and data conversation. We use a lot of that data and data to produce a document called a district needs assessment. This district needs assessment speaks before you can complain about the pothole on your block.
Yeah.
This district needs assessment is used by every agency in the city, state, and federal government. When they look at our communities, they try to get an understanding of what's going on locally. They look at a community district needs assessment, and every agency is consulted by the district office and community board to get a handle on what the community needs. If we have an undercount, we end up with a whole lot of needs, and for 10 years, every year when we produce this district needs assessment, those needs will not be met because we don't have enough people to meet it. I always use the example of trash, right? Everybody's always concerned about their community being clean. I represent Community Board 5, which is East New York. We have a chronic dumping problem. And we have a building problem, right? There's so much more development happening in the community. So that means there's a surplus of people coming into the community every year. And they are not counted because we're still going off of the 2010 census. So these people are in spaces and places where there were no people. They put out their trash. Trash needs to be picked up. The current sanitation services are overwhelmed. Every year for our district needs assessment, we put in for a tri-day pickup because we see it as a fundamental need to keep our community clean. Nobody likes raccoons running around in their backyard, their front yard, and being scared walking down the street. You're talking about other dangers. People are scared of raccoons. So we need this tri-day pickup, and we've advocated for it every year. And Borough Hall, we have borough consultations where we sit down with the commissioner of the agency. This would be sanitation. We sit down, we have this conversation every year, and she refutes it every year. We will not get the tri-day pickup because we don't have the tonnage, which is also connected to the amount of people. This is a very simple thing like trash blowing down your block, how it becomes this issue that is like so connected to the census. So within the community board, that's just an example for you to take home and to really think about it if you're passionate about trash. But
well, I mean, you're like, I'm passionate about getting rid of trash, right?
Absolutely. And wanting your community to be clean. But community boards have been instrumental in forming these complete count committees, right? A complete count committee is essentially community stakeholders that have taken it upon themselves to hold themselves responsible for getting out a complete count in their neighborhood. Chris said that 10 years ago, we were at 62%. Right now, Luke can speak to this. There's a a website called Rome. I forget what the acronym stands for, but you can look at your census tract, literally where you live right now, and see the percentage of censuses that have been filled out. Currently, and this is in Community Board 5, I've looked at surrounding communities. We are all hanging around in the mid to low 30s, 30% filled out. So we have a lot of work to do. So this is where the action, because I'm an organizer, right? This is where the action piece comes in. I know at least 10 brothers, and I'm gonna exclude the chapter because that's so easy. It's so easy to just get frat. I know 10 brothers. I could get 10 brothers to commit to the census, and that's too low. That's too low. But I want everybody who's a part of this, not panel discussion and a participant, to make sure that 10 people fill out their census and look at your own census tract and make sure it's done. The onus is literally on us to make this happen. And I guess that's a home run in terms of bringing it home. But I had another point that I just want to just close with. Okay. We see and we know that the structure of our society, its foundation, wants us to be invisible. This isn't rhetoric. I said it earlier. When the census was first done, we were 3/5, 60% of a person. It is committed to make us invisible. COVID-19 just gives it a big cover up that, look, we couldn't get the word out, and we have to take the responsibility on ourselves. We have young people in the streets, we have old people in the streets. They're in the streets because they want some type of fundamental change. They want representation that speaks to their needs and their issues and that can be held accountable. None of this happens if we don't fill out the census. That's just it. Our representation goes down. We're on track to lose a city council member. And that's problematic because city council members, get the governor, the mayor, city council members have the most amount of power to make the difference that you can see immediately in your community, immediately. So we lose that, then we lose our voice, we lose our representation, we won't be seen, and we'll be back here in the next 10 years having the same discussion about why we can't get what we want. So let's make ourselves visible, especially when our society wants us to disappear.
No, that's driving it home.
No, I mean, no, that's not, man, that's not driving it, that's speed racing it. You know what I'm saying? Right, you know what I mean? He was going a million miles per hour, man. No, thank you. Oh, man, this was really great, and I have a number of questions that I want to get to, and if anyone else have any other questions for our most talented, fantastic panel, please ask away. And the first question that I have, and it's from Quentin, and Quentin writes, I rent 2 rooms in a 2-family house. I got the census letter. Should I fill it out for all of us as a household or just my household?
So you would fill it out as 2-family homes. You would fill out one for one household and the other for the other household. So when you look at the questions, it just asks how many people are living in your home, and you just would complete that. Again, if the person is living in your house or in your apartment for a substantial amount of time, not like staying a week or on vacation for 2 weeks, but it's there, you need to count them as part of your household.
Well, no, so if I'm not mistaken, I think Quentin says that, oh no, sorry, matter of fact, I actually read it wrong and then you were spot on. Okay, so no, thank you so much, Luke. Another question that I have from Dayton, and they say, have they extended the time to fill out the census as a result of COVID? And to add, when is the deadline?
So currently, we're supposed to have a census call, a briefing call with the directorate in the coming weeks. And that is part of the discussion to extend the deadline. Because as you know, or if you may not know, the actual dates and the timeline of the census is legislated. Like it's in the actual code that authorizes the census. And so doing anything outside of that, we would have to get Congress approval, et cetera. And so that has been part of the discussion. And to tag into something that Keron said, one of the things that we were planning before COVID hit were partnerships with different community centers, rec halls, places of worship, to give access, libraries, et cetera, to allow folks who may not have access to a computer to complete the census, to allow senior citizens who may need assistance in the document to have someone there to assist them. All of that was impacted tremendously with stay-at-home orders all across. And so, as Keron said, this is very vital that we do that telephone game on our social media, through our text messages, through our emails, etc., telling folks to take the census, whether it's paper or online or even on your phone. We've enhanced the options now where we actually have a phone capability for any type of phone where you can actually take it right then and there and submit it in. The census only takes about 3 to 5 minutes.
Oh, fantastic, fantastic. So Juan has a question, and he says, do we count our loved ones that passed during the census counting period? If not, that disproportionately affects people of color?
So the rule is, so the census start date is April 1st. If the person is alive post April 1st, they are to be counted. Anyone who deceased before April 1st is not to be counted on the census. Mm. And sorry, the last question asked, when is the deadline for the census? The current deadline is mid-June for the census, but the proposed extension is until October.
Okay. Right when the NBA ends, right? Yeah. So, Antoine, no, Aaron asked, so I'm aware that colleges and universities count all of their students on campus in their census. But is that still the case because of the current situation and the closing of dorms, unless international students have emergency situations?
So there has been guidance that has been given to the higher education institutions to one, if the students are returned home, then they are to be counted by their household as being counted. And again, as I mentioned earlier, we have quality assurance team members who are hired during the census to rectify that data to ensure that you're not counted twice. So the schools who are not housing students should not be counting the students. But even if they do, we still have the quality assurance team who are sworn to confidentiality to be able to correct that on the back end.
Mm. Got you. Okay, awesome. So if anyone doesn't have any last questions, I just want to go to each of the guests who gave us fantastic information. I've learned so much, and round of applause for all of them. I mean, right? Like all of America is going crazy right now, right? Because of you guys, right? Oh man. So before I was gonna pass it off to you three just to give your closing remarks, we have 2 quick questions. One from Gary, and it says, Chris, how are hospitals ensuring folks are aware of the census?
Yeah, great question. So we before COVID, all of the New York City health and hospitals, they were either setting up census little hotspots where people would come in. We would provide the computers and they can log in. We would help them. We have census people, the whole nine. Moving forward, now that we opened up our hospitals, we're starting to talk about census again. So we just opened up June 1st. I'm glad to let everybody know that we are open, we're clean, we don't have a lot of COVID patients. We still take care of our COVID patients that we currently have. My hospital only has about 15, from all the way up to 400 at the height of COVID we had. And so kudos to my staff, to all of NYHHC staff. We really took great care of our employees as well as our patients.
Yeah.
We did not have what you were hearing in the community, or I should say in the media, of not providing our staff with PPE. We provided all our staff with PPE. So I was very proud of my staff as well as my corporation for doing that. I did want to let you guys know really quick. I love this video of a doctor. His name is Dr. Joseph Salvo, and he is the New York City's demographer. And basically, he uses all data from the census as well as other surveys that are used by the city to then map out for the mayor's office, commissioners, deputy commissioners, what is the data showing throughout the census. If you got, his last name is spelled Salvo. Great video. It's really short, maybe 10 minutes, but he describes how data is really used. And also what I like about him, he's a nerd like me, loves the data, and drives to it. So, and don't you say anything, Gary or Ted or Vic, I'm gonna kill you.
So last remarks. What are your parting words? Let me start with Luke.
Sure. As mentioned throughout this discussion, taking a census is very, very, very important. I appreciate our sisters on the Zoom call right now, in solidarity with us. Much love. As we've seen the numbers with Black men, and as you mentioned, us being counted has been so low. And so while this is a discussion about Black men that we count, we also need to reinforce it in our families with our loved ones. And I think this discussion needs to carry on. And so this shouldn't be the last time that we discuss this. This shouldn't be the last time that brothers get together and talk about what's important for us, especially for counting us and making sure resources are allocated for us. And so I encourage everyone to do as Keron said, tag at least 10 other men and send out to them to take the census. Thank you.
Yep. Awesome. Chris.
Sure. Listen, guys, thank you so much. I really do appreciate it. It was great doing this with you guys. For my frat brothers who know me and frat brothers that just know of me, you know that whenever I leave you all, I always say I love you. So I do love you guys. I love you sisters that are out there too. But we really need to love up on each other. This is a difficult time. The census is really, really important. But if we're not listening to one another, they're not listening to us talk about the census. And so we just need to ask everybody how they're doing and really be mindful of what people are saying, not what they're doing, but what they're saying and what they have in their hearts, because a lot of folks' hearts are heavy. They don't want to admit it, but this is where mental health, behavioral health comes into play. So just be mindful of everyone, be mindful of the situation at hand. And I love you guys, and thank you for allowing me to share my thoughts with you.
Awesome.
Love you too, brother.
Keron.
I love you too. Jeff, you want me to go?
Yes, please. Mm-hmm.
So Chris asked for mindfulness. I always say, be gentle with one another.
Yeah.
You never know what everybody's going through. You never know what's on their mind, what's on their heart, et cetera, et cetera. I was excited when we first started this panel. I'm still just as excited, just as fired up. I really appreciate asking me to be a panelist. Juan, again, your leadership, much appreciated in this time where we really need it. And leadership, it looks different for everybody, but yours has been stellar, so really appreciate it. Jeff, I know you're a leader in your own right at Gentleman's Factory. I know a lot of the guys who go there and participate, from Kelly to Dale Ferdinand, you know, all of those guys. So just appreciate you and what you're doing for Black men all across the globe, because, you know, I figured that yesterday after you told us. What I will just, my parting words in terms of what we can do, you know, where our mind should go. We got to be creative. We got to be strategic. We're in a time where there is no blueprint. We got to create it. We can't be looking out. We got to look in. We got to look in our communities to figure this stuff out. And in terms of how we get the word out, all of the pieces are in place. As the city starts to open out very, very slowly, where do Black men go?
Yeah.
You know, a lot of us, we need a haircut. We need a haircut real bad. Going to barbershops, and making sure
my wife cuts my hair now, man. You know what I'm saying? Right?
You're an evolved brother. I see you. But some of us are going to be rushing to those barbershops. We got to make sure census material is there.
Yeah.
We got to make sure our barbers are ad hoc census informants. You know, they got to be able to inform while they're giving their cuts. Yo, you know, have you done the census? Like, we got to be strategic and very, very creative. We're on the cusp of summer. You know, block parties may or may not happen, but for the ones that do, census material has to be there. We have to break down and talk to people. I know social distancing and its own, you know, oxymoronic kind of way makes us stay away from one another. We got to get close with information. We don't have to be close physically, but we got to get close with information to just make sure that our communities are counted. And I don't want, in the next 10 years, I did say 10 years ago, I was 19, I was up in college, I wasn't thinking about none of this stuff. 10 years later, I'm 29, in 20 days, I'll be 30. I have one child. I don't know what the next 10 years is gonna bring. It's gonna be totally different. So I wanna make sure that I have to take care of not only myself, my greater community, my building, everybody, by just taking 3 to 5 minutes and filling out the census. It is that simple. We scared y'all with enough data. Now the simplicity is to just do it.
Yeah. Wow. And Mr. President Juan Perez, any parting words, sir?
You know, to be quite honest with you, I think the gentleman said it all. I think that the call to action that people are marching in the streets is for us to see change, right? And what the gentleman talked about here tonight is a great starting point. There's no reason that we can't make tremendous strides, you know, by filling out the census. If we have a full count amongst Black people in Brooklyn, how great would that be? And that's not a far-fetched goal for us to achieve. A full count amongst Black people here in Brooklyn. I just wanted to give a shout out to Brother Ramon Walker, who is working in the background for this thing.
Cutting Jeff off, yes. Very nice.
Thank you, Ramon.
We appreciate you.
Oh man, definitely awesome. So this has been absolutely fantastic. You know, so we were you know, so honored to partner with you gentlemen here on today. The information that was received is priceless, right? You know, and one of my favorite quotes is, you know, people operate in life based off of the level of information they've obtained. So now that we've been here for a little bit over an hour, you know, we're now going to be operating differently because of the valuable information that was just shared here. So we're no longer the same. We are made new because of you powerful gentlemen. So thank you all so much. And this is only the beginning. I mean, like, we should definitely have more of these joint partnerships, gentlemen. And, you know, I personally want to thank you, Juan, and, you know, Luke and Chris and Keron for the great information, because what you did for not only myself, but for the community, it will spread through like wildfire. And for everyone else on this call, you know, continue to be safe. And for those living in New York City, stay home at 8 o'clock, right? You know.
Can I just say one other thing? So listen, if you want to get a nasal swab to check if you have COVID, you can actually go to NYCHHC, NYCHHC.org, and you can find out where your local testing facility is. So Woodhull, obviously you can go to Woodhull Hospital, you could go to King's, Coney Island. If you're in the city, Harlem, my place, Metro, Metropolitan, Bellevue, all of the city hospitals. But then we just opened up tracer sites nearest to each one of the hospitals. So just go online and it will let you know.
Awesome. Thank you. So everyone, please stay safe. And always remember that social distancing does not mean social isolation. So make sure that you build with each other, share information, and let's continue to build. All right. So see you all soon. God bless you. Stay safe.
Later.
Good night, everyone.
All right.